Oral health care is one of the main components of general health. To preserve your tooth is the best solution for the healthcare system. Therefore, the best collaboration between dentist and the patient is needed for providing oral health. Let's have a close look to the dentist's responsibility for preserving the tooth level by level. If the patient suffers from mild to moderate caries, the well-done aesthetic filling would be the choice for management. In case of a pus formation or infected tooth nerve, then we do root canal therapy with automatic root canal equipment and laser equipment at one appointment, and it will be fully over. If unsuccessful root canal treatment has been made, then treatment of root canal therapy will be tried again and be manageable. So, these all I wanted to explain are the basic treatment modalities to preserve the tooth and keep it in mouth in an effective solution. If there is ongoing dental disease, though we do the best for aesthetic filling, root canal treatment and root canal retreatment respectively, then we would decide to do different sorts of surgical operations according to the diagnosis of the tooth. These are all just for the tooth keeping intact and keep it inside of mouth besides removal. If there is still ongoing dental disease of root and pus formation, the first option will be root end resection. The basic procedure of root end resection is based on removal of 1/3 of the tooth. So the pus involved tooth root is being removed and keep the root 2/3 of the tooth is being intact, and the tooth also. So it is one of the best way to keep and preserving the tooth in a way. Another options is hemisection. Just consider about the 2 roots for 1 teeth, especially for the back areas. So if there is one pus formation at one tooth root and there are available 2 roots of the one tooth. So if there is one root is intact and one root is in disease, we can remove just only one root and keep another one intact, and half of the tooth is available and being intact. So after that we can insert and rehabilitate with the prosthetic crown or bridges, so within a little bit wider than normal. So good chewing and comfortable and preserving the tooth root and tooth together. And third option will be the reimplantation. If there is a pus formation, even though we already tried and managed all the things that we already done with root canal treatment and root canal retreatment and aesthetic filling together, and even though these all procedures that we performed, we couldn't manage to prevent the removal of the tooth, then we try to remove the tooth and cut just the end of the tooth and root end and reimplant it again. So we put it again and it can be served in a way for a long period of time. So it is also manageable. So we remove the tooth and cut the tooth root and put it back again. So it might be fully contact and fully adapted to the gum and also the bone. so it can be solvable. So the fourth point of preventing and preserving the tooth is, if there is any problem and dental disease with, for example, in the first molar region, first back tooth molar region, and we should remove it in a way. On the other hand, in the back, a 20th tooth is visible and very good in condition, and no need for staying over there, and it is very empty and no incoming and biting function for chewing. I do prefer removing of the first molar with dental disease and transplanted of the 20th regional tooth instead of the first molar tooth. So there is an auto-transplantation procedure that to preserve the region of the first molar. So I already mentioned about 4 rescuing, preventing procedure for removing you, preventing you from the crowns, preventing you from the implantation. So the best solution is keeping intact of the tooth in a way. So ultimately, I do recommend to preserve the tooth as long as I stay in the mouth. Just believe that the remained root after caries and root canal treatment is sufficient for preserving and reconstruction the tooth with crown. Well-under structures tooth is very perfect guide for the upper structures as tooth-like. Recently, implant operations are very popular, but nevertheless, there are still many complications during the surgery and after the prosthetic rehabilitation like crown or bridges. Implant would be the last choice as treatment modality. I'm still away from the removal of the tooth, insertion of the implant and making crown on it. So, preserving the tooth have many advantages, keeping the tooth root in the mouth, preventing osteoporosis of the jaw, providing gum health, natural chewing dynamic capacity is being given to the patient with the natural tooth root. Preventing with the natural tooth root and preventing the fracture of the jaws as well. At the same time, prevents the decay of the adjacent tooth. The last one is preventing the gum disease and providing longer life for you. So please do your best and keep your all teeth in your mouth for your best health.